Case Western Reserve University School of Medicine has a National Institutes of Health-funded gastrointestinal cancer center. Dr. Sandy Markowitz says it is one of 5 in the nation working to provide accurate diagnoses, advanced treatment options, and clinical trials to fight cancer.
There's 3 ways we can reduce the number of people that die from colon cancer. We can find it earlier, we can find ways to prevent it from happening, we can find ways to treat it better. We've done all 3. We were key folks in developing a new technology for early detection of colon cancer by detecting abnormal DNAs that colon cancers make and that you can detect in the stools of individuals who harbor these tumors. The clinical trials here are being led in the Cancer Center by Dr. Greg Cooper.
What we're interested in doing in our study is seeing how well this test performs compared to colonoscopy. So all the patients in our study are getting both the stool test as well as a colonoscopy subsequently. We want to look to see how well the stool test detects large polyps, and we want to see whether the test performs as well in African Americans as in other racial groups.
The second area where we've made an important contribution is in understanding aspirin and its role in being able to protect people from developing colon cancer. About 18 months ago, we teamed up with a group at the Harvard School of Public Health, and what we showed was a pathway that we had discovered here, which is sort of the body's own aspirin. It's run by a gene that's in the colon. It's called 15-PGDH. What we showed is that aspirin really only works to prevent colon cancer in folks in whom their own aspirin is also very highly there and active. And in the folks who have high levels of this aspirin, taking the aspirin pill cuts the risk of colon cancer in half. So it's really a remarkable effect. The third area where sort of basic genetic research in colon cancer is a study that we just completed a year ago that looked at colon cancers in African American patients here at the Case Medical Center. When that African Americans get colon cancer, it's a worse disease. So the question was, is the disease the same disease? And what we found out is actually the tumors aren't the same. That about 40% of African Americans, when they develop a colon cancer, have a distinct genetic signature of those tumors that we don't see in the Caucasian patients. We have active clinical trials on the DNA detection test. We have done clinical trials on the aspirin test and hope that we can do future studies that will confirm what we've discovered. And we hope that the work we're doing on the African American cancers will lead us to clinical trials of new ways to treat them.